Welcome again. Thank you for being here. I'm Lynn Penke-Valdez. I'm the other Deputy Administrator for Ottertail County of the Health and Wellness team. I'd like to turn this, it's my pleasure to moderate this next panel, and I'm going to give each of our panelists and experts the opportunity to introduce themselves. We'll go down the row, and if you want to say who you are, where you work, and what you do.
Good morning, everybody. I'm Carly Carlson. I'm the Human Resources Manager at Brunswick, New York Mill, so probably more commonly known as Lund Boats and Crestliner. So thank you for having me.
I am May Verzonki, the Population Health Coordinator for Perm Health.
I'm Steve Guttormson with Pioneer Care in Fergus Falls, Minnesota, Fergus Falls. And I am the Marketing and Development Director there.
Hi, I'm Michelle Hutchinson. I'm with First Children's Finance. I'm a Business Development Specialist for the Northwest region.
Thank you. I think I'm going to try switching microphones with you. My first question, and this is a question for each of you, and I'll try to take turns on who I call on so that we're not just going down the conveyor belt. Why is it important for employers to be part of the conversation about childcare?
We started at our operation the conversation years ago, just like we started the conversation with schools and the county on employees, and I think it's that important. I think to be able to promote that family culture and to get your workforce, you have to be willing to have that partnership. So what triggered it for us was hearing right from our employees that there was a gap. Personally, I was affected by it. I moved into the area and had 7 months before my kids could go into childcare. So it was just naturally dear to my heart, but also to our workforce as well.
Our project, and I'm going to call out KLN and Rob Mosier in the room and Justine Anderson. So our project is kind of a community effort by employers. We are combining or partnering to expand our childcare center. And we are at a point, and I think the session prior to this really enlightened us on how big of this is, but employers really need to start thinking of childcare as an employee benefit. We are seeing people leave the workforce that want to work but have to stay home in childcare, but our entry-level salary points aren't even meeting what the costs of childcare are. So we as organizations have determined that we need to do something if we want these people to come back to work. Also, the flavor of childcare isn't in any better shape than we are for employers. Again, there is a shortage out there. It's a hard job to do. And we are exploring the center model because it's hard to get home-based daycare in our area in Perham. So that's why we decided we had some space available, so we started exploring what that would look like, and we are now expanding our childcare center that currently rents from our facility.
Well, at Pioneer Care, we got involved because, and it was mentioned in the earlier panel with the issues with healthcare and the numbers that were put up here on the screen. And at Pioneer Care, at our peak, we had about 300 employees. Right now, we have 230. So we've seen the numbers go down drastically, and we can't close on Mondays, and I'm not minimizing other businesses' challenges, but we do have some unique issues with that give us some limitations on what we can do. So I think we take a pretty holistic approach with our employees, and traditionally we've looked at childcare as an individual problem. That's the individual's problem to figure that out. And I think we've come to the realization that no, it's not. It's a community problem and it's an employer problem. It's something that we have to be part of. So that's why we've gotten involved.
I'm going to echo pretty much what everybody's saying. It's important for employers to be a part of that childcare solution. We know that quality childcare means productive workers, and productive workers, not just now, but in the future. With the investment of early childhood, for every $1 spent, we'll get a return of $17 on that investment. So childcare is a direct tie to our local economic fabric, and without that quality care, people can't return to work.
Again, oh, there's a little delay. Steve, you touched on something when you said we came to the realization this is a community problem and not an individual family problem, and that resonated with me. Just by show of hands, how many of you personally had a challenge with childcare? And that affects even some of the grandparents in the room. And now as employers or professionals, how many of you have experienced the challenge related to childcare? Yeah. All right. Many of you have been having these conversations about childcare for a number of years. But what was the driving factor or the impetus that made you take action? Where you said, all right, we've got to solve this. No one's going to solve it for us. This is impacting our bottom line. Do you have a story or some data that illustrates your employees' need for childcare? What was that impetus? I'll start with you, Maggie.
So about a little over a year ago, we actually, between KLN and Perm Health, we did a survey just because like we know we've been hearing childcare shortages, we've been hearing how bad it is, we hear the stories from our employees. So we did a survey, and we found out between our two organizations there was at that time currently 200 kids that needed childcare that day, and only 30 or 40 of them had actual slots and were being taken care of by a childcare center. And we were like, this is unacceptable. We need to do something. And then with that, there was a projected another 100 kids that would need in the next year or two childcare. So that's what drove us to finally take action and start thinking of it as an employer problem, not just an individual problem.
Well, at Pioneer Care, we dabbled with the idea of childcare like many of us have over the years. Basically, the first conversation I had about it was in 2017, and I think we talked about it then, and just kept pushing it to the back burner because we didn't really know for sure, how badly it was needed. We did do a survey, I think it was in 2019, with in collaboration with other healthcare providers in the community, and then we, Patty Fandrick, our HR director, who's here as well, started a focus group of employees on the Pioneer campus, and one of the first things they brought up, we asked, what can we do that's different? What can we do that we're not already doing? And childcare came up. And interestingly, it came from two men who work at Pioneer Care who don't have children, but they recognized the need from hearing from their coworkers and seeing coworkers have challenges with getting to work on time or not being able to work because their childcare provider closed for the day and things like that. So that's when it really became kind of a driving force for us to get involved. We did a second survey to get some solid numbers, and just and decided that we've talked about this for years. Do we pull the pin on it, or do we just push it on the back burner and leave it there? So we decided that it's time to do something about it. So we started Pioneer Kids.
I have a very similar story, I think, to both of them. So our journey was exactly the same as we heard it from our employees. We did multiple different surveys to ask, what if we partnered with a daycare? What if we had a daycare? What does that look like? And for us, it was a lot of interest, but it was even the comments of that, the reason why my spouse doesn't work here, or something similar to that, is because of childcare. Or the hours that our operation runs isn't compatible with a lot of daycares. And so overwhelmingly our team was saying that there was a need. And we then formed teams that worked on collaborating this right with our employees and saying, so what does that look like? We talked about, do we do different shifts or what do we need? And it just went back to people really said, it doesn't matter, there isn't a place for me to bring my child for daycare. And so we knew that we had to support them in that. And really it also had to be something that we supported where we are. And a common thing that we talk a lot about is, what is our community? And naturally our community is New York Mills, and we're grateful for the partnership we have, but our employees, probably like everyone's employees, commute a long ways. And so we wanted to also try to attract future employees into our community as well, and really helping support that.
Lynn, you also asked what it looks like at our business, and Pioneer Kids is a home-based childcare provider. We're looking at the pod model, and so we have one. The other thing that was a motivator was space, and that's an issue for a lot of childcare providers is just getting the space to do that and invest in that. And we had an open, because of our workforce challenges, we had a memory cottage, Pioneer Cottages, that was vacant because we've actually brought down our capacity because of workforce, and the space was perfect for childcare, so that was another way for us to get involved.
Thank you, Steve. Michelle, can you tell us about First Children's Finance and why or how the organization supports providers, supports communities, and supports partners?
Yes, hi. So, we are a nonprofit. We work on 3 different levels. Oh, I guess we're back here. All right. We do work on 3 different levels. So we work on the individual level, where we work with family home child care providers and directors, and we talk about the business side and how to sustain their business or how to expand. We work on the community level, where we come in and we do something called the Rural Child Care Initiative Program. And then we also do something called the Strategic Supply Plan, which is another program we do. And then on the systems level, we do advocacy at the Capitol and, with DHS, however we can help. We have ongoing education, we do supportive services, and then we have access to capital, not just with lending, but we also do grants. So any community work, that grant would be $30,000 for a project. If providers take a class, our business leadership cohort, they get a $1,000 grant for their project. And if it's a childcare center, they get $2,500 or $3,000. And then we also have something called the revitalization grant, which helps programs, both family and the childcare center. Maybe they need to change the flooring because they've had kids on it for 10 years straight, or maybe they need to put up a fence, things like that. And then we look at the challenges of childcare, and this was during the pandemic. We saw many closures, which equaled to loss of jobs, and then parents struggling to find and afford quality care. And then we were unable to get that learning environment for children because of all these childcare programs closing. And this is before the pandemic. We know there's 76% of Minnesota families had available parents that were in the workforce. So now it's worse, right? Okay, so we're going to look at childcare operations. Centers are organized under Rule 3, so it regulates how much square footage they need, their play space, toilets and sinks, and they're normally regulated by 3 different agencies. And we're just going to skip through that, but we know that childcare delivery is really high. The biggest thing is staffing, and then the facilities, and then food. That leaves you 5% for your profit, if that. Most childcare centers do not cash flow. And then we look at the family childcare. They're organized under Rule 2, so that's your county, and then they're regulated by the county, and their age ratios are a little different than what we saw in the childcare center. because it's a mixed age program. We'll skip this one. So we look at family childcare. On the average, they're working 65 hours a week, and they're making about $11.37 an hour, and that's before taxes. So again, we can see it's not a big money maker. And so we look at the trilemma of childcare business. We need to be accessible, we need to be profitable, but we also need to be quality, right? So the other thing that we do with the community work, we make sure that there's a right size solution for that community. We say don't get fixed on a certain building or project. We don't expect the private sector to be 100% of the solution, but there needs to be a good policy and incentives within that community. And we also say to involve existing providers in community solutions. They've been doing childcare, they know the area, they know the culture, they know what needs to happen. Always run financials first before committing to a project and look for a broad base of support. And that's one thing that we do say has really helped push these projects forward, right? So we can help by getting in touch with us. We can help individuals. Like I said, we can do things with the communities. Right now, Fergus Falls is doing the RCCIP. I think their first provider event will be December 1st, and then January 30th, they'll have a town hall. So if you're in the Fergus Falls area and you want your voice heard about childcare solutions, please come to that. Alexandria right now too, we're working with them, and I think they're already a little more ahead. Fergus Falls is doing that gathering of data. So we do the surveys with the employers, we do surveys with the parents, and then we also do surveys with the childcare providers themselves. I think that's everything.
Thanks, Michelle. Okay, so what we heard from you, Steve, Maggie, Carly, was you heard from your staff, there's a problem. You could see it. They told you. You started to look at what does that look like for us with our individual needs as employers. At what point did you start to connect with other partners, other resources, and how did that work? What was your relationship with Ottertail County, with your local business partners, nonprofits, Chamber of Commerce? Can you speak a little bit to what that work looked like in a real tangible way? We'll start with you, Steve.
Well, I guess I'd say we started with our employees. As I mentioned, the two guys that were part of the focus group, one of them happened to be a former childcare employee, so he had some background in it, and they had actually kind of sketched out a plan, and they said, we think, you could do this over at Pioneer Cottages. And so they helped us see it. And then from there we went to West Central Initiative, talked to Marcia Erickson, and she was kind of our hub for getting us in different directions and led us to First Children's Finance. First Children's Finance really helped us through a business plan and a financial model to see, what we could do and what scope the project would take and what we could afford to do. We had maybe bigger dreams of what we could do. We thought about doing 2 shifts, maybe we can also help our evening staff. But when the numbers came down to it, and she helped us kind of see the reality of what we could start out with. So that was really helpful too. And Lisa Spangler with the county did kind of a preliminary walkthrough of the Pioneer, of the cottage, the space that we were thinking of using, and that was really helpful before she came over officially to license the space. So those, I think, are several of the main players that were involved in our collaboration.
Carly, do you want to talk about what that looked like for you?
So for us, as soon as we heard loud and clear from our employees, we tapped on our partners at the New York Mills community in the city, and we talked for years about it and explored many different models. We looked at independent daycare providers that maybe wanted to get out of their homes. But one thing for us was that we did not want to operate a daycare. So we were very clear that we will support it. We want this so bad. We want this partnership. but we don't want to operate it. And so thankfully, our partnership that we had and still have with the city really worked well with that. And working with them, they were able to find a building that needed a little bit of renovation. We supported wherever we could, whether it was financially or through our labor that was available, and just continue to have that great partnership. Absolutely, members of the county were involved. And really our model is we support a financial piece of it, and we make sure that there are spots always available for our employees because the provider has to operate the hours that our team works. And for that reason, then if there are spots that are not taken, we will supplement that to make sure that the provider will continue to be there as well. And so I think it's just a great example of, especially in our rural communities that we're all part of, but really partnering with your community. I feel like that partnership was so great and has flourished into many other things that we continue to talk about with them as well.
So listening to the two of you, I hear similar, but also a little bit different in the model and the approach you took in terms of who owns the building, who is operating it, and how that looks like. Maggie, how about you?
So I'm kind of like a perfect blend between these two. So our project started out, we decided, yep, we're gonna do this. Our team reached out to KinderCare to do and help us make an assessment of like, where do we start? And you know, KinderCare is a big child care center. We identified early that we wanted the center because we are Monday through Friday. We cannot have days off. We can't be taking time away if there's like a medical emergency. We need to have stable care. So we identified early that the center model was what we wanted to do. Then KinderCare we were looking at them from both a consultant to help us, what does this look like? Because like Carly, we did not want to get into the child care business, and I think the picture behind us really painted that for us. Because we healthcare, we have problems too, so we wanted to we wanted to have childcare be its own thing. So KinderCare was also consulted as maybe that we bring KinderCare in because they are their own entity. However, we got their tuition prices and we're like, yeah, that's not happening because it was so expensive and our employees would never be able to afford that. So I don't know how many of you are familiar with the Perm area, but where the old hospital was, Boys and Girls Club moved in there. They recently left to their new location, leaving us with a vacancy in the old hospital space. And we're like, all right, we have a childcare center in this space already. What if we partner with them to expand? They already have a connection to M-State. They have a pipeline for staff, because that's the other big thing that Michelle said is staff. You have to have staff if you're going to do this. And so we felt with that connection, we do have a pipeline for staff. We also have a partnership with the school. They're teaching child care aid classes in there, so they're coming out of high school with these credentialing that they need to work in these centers. So we form partnerships with that, and then we also, when we first set out, we're like, all right, blank check, let's go at this. What do we got? So we gave it to the architects, and they came back with us, if you want your ideal center remodel, it's going to be $4 million. And we all like, this isn't going to work. So we had to reel in a little bit. And then what we're doing is kind of a phased approach. And I'm also I'm not as far along as these two are. Our project is just getting off the ground. We're in remodeling right now, crossing our fingers, a January 1 date, we can start going. But we are just kind of remodeling the current space, new flooring, new paint, starting with fewer rooms. So we are opening up, I think, 8 infant slots and 10 toddler spots, 7 toddler spots, something like that, with the eventual growth into 3 sets of infant, toddler, preschool rooms in the future as demand is needed. Then we also, because it is the center model, we knew that it comes with a higher tuition rate, not as high as KinderCare, but it does come at a higher rate than the home-based care. So we identified that if we're going to invest this money to make this child care center work and expand, we need to also make the tuition affordable for our staff. So our organizations got together and decided that, yep, we're going to subsidize tuition and hold spots for our staff, and we're working through the agreement on what that looks like. But it will be the average rate of a home-based daycare for our staff to have childcare in the childcare center.
Thanks. Earlier today, we heard the gentleman from Deed talk about culture. And I'm curious, what benefits to your workforce have you seen, or what benefits do you anticipate you're going to see? This is new territory, a complete shift for how your organizations do business and operate. How has it impacted your culture, your bottom line, your workforce retention? Can you talk about the benefits you've seen?
I think one basic thing that you'll find is it's an example of hearing from your team and actually doing something. So, we knew it and it was scary, and I think probably all of us felt overwhelmed by the fact, and I agree with you, it got very expensive at many moments and overwhelming, but being able to go back to the team and say, remember, this is because we heard from you, and this is what we're doing. And there was a comment earlier about employers not giving enough credit, and I couldn't agree with that more, and I think that's the modest Minnesota, someone said, and it's a truth, and it's hard to do that, and oftentimes I think we have to remind our team even that, remember, we have our daycare, and for them to promote it too. But that partnership, and then also for our team to see our partnerships with our community, knowing that, people don't always understand all the behind the scenes, but for us, it really was taking as something that our team said and working through it and making it come reality, having our employees be part of the whole journey so they could also see the challenges, because it wasn't easy, right? We all know that, and they could understand why it didn't happen faster. But that has really been a great partnership for our team.
So this is all what I anticipate is going to happen here come January 1, but we are no longer, work-life balance is not a real thing. We have to start thinking of it as work-life blend. And when somebody, I personally struggle with daycare, much like Carly, and you can't think about work when you're worried about your kids, who's picking them up, who's doing what, who's switching, do they have all their stuff. That we don't have productive employees when we do that. And a lot of times it's just way less stressful to say, you know what, I'll just stay home because I can't handle this. And so I want to create a culture where we're really focusing in on that blend. We care about your life outside of work. We have childcare taken care of. They're going to cover your hours. That's a safe place for them to be. They'll get an education while they're there. People start to tap into that, and then we start hopefully stacking employees up outside the door because they want to get in. It is my hope, but again, really taking that work-life blend culture and integrating it into both Permanent Health and KLN's organizations.
I'd agree. I think one of the big takeaways for us is that even our employees who don't need childcare, it says something about who we are. And that just speaks volumes. And I don't think I even really anticipated that until I heard it from our employees, that commented on, this is what Pioneer is, and this is what we do. So we take care of each other, and that message came through, and it's really great to hear, and it's a powerful thing. That said, the people that we are serving, we're serving 7 families now. We opened September 6th, so at the start of the school year, we're going to start that date. We're going to give that, because that was the primary time to start for us, where we were with the timeline. And so we're serving 7 families that are Pioneer Care employee families, and we're serving 3 families from the greater community. Everybody involved is somehow in healthcare. We're really, we kind of see it as a healthcare specialized provider because of the unique needs of the shifts. So it really helps in that way. Another way that it helps with us being intimately involved in the operation is we can, out in the community, those of you who have worked with childcare probably know that, whether you use 2 days a week or 5 days a week, you pay the same rate. You pay that same weekly rate, right? So at Pioneer Care, because we're doing it on site and we're involved, we can split a slot and let one employee have that slot for 2 days a week and the other have it for 3 days a week, because our employees typically only work a few days a week, and then, the weekends. So schedule-wise, we're able to actually benefit more employees that way, if all the stars align, because the kids have to be kind of fit in the right slot and everything. But it works. It's working right now. So that's, part of the, I guess, some of the biggest benefits for us.
All right, just as my colleague Nick Leonard did, I'm going to let you know I've only got one question left, and then I'll be looking to each of you for what questions you've got for these folks. Our last question, you're in the childcare business now, and it is in an effort to match the needs of your workforce. What does this mean for your organization in the future? What does the future look like? And let's start with you, Maggie. Okay, who would like to start? Maggie, you think on it.
It is a tough question, so I agree with you, Maggie. I think it's just an example of embracing change. So this, and then what's next, it growing. Obviously, I think it's going to continue to grow. We've talked about, we have a weekend and we have an evening shift. Do we look to expand it into that? But embracing unique things. There are things that we've all embraced the last couple years in particular that, I'll be honest, in my career, I never imagined that we'd be doing. And I think it's just being comfortable with the out-of-the-box things that you need to be willing to do to support your workforce. It isn't only the old things that we've always done. We have to think outside of the box.
What she said. Anyway, it's kind of like, we're kind of seeing a frame shift here in workforce, and we are all excited about new products and new service lines and how can we get to the customer faster, but then sometimes we forget about our greatest asset, our employees. So what I hope is really flipping that narrative a little bit and helping organizations, or inspire organizations, and do more to, like, what can we do to support our greatest asset of employees, because there's not many of them, as we saw in the numbers, that we need to make sure that they're first, and then if they're good, then we can grow more, because there's such great research out there showing that if you have employees with a good culture and a good work base and they're excited about your organizations, you're going to see your return 100-fold sometimes. So I really hope to see that for our organizations that are partnering on this project in PERM, is like, that come work for us. We're a great place to work. We got places to play. We got places to live. We got great work, and we'll all take care of it, and then we'll just flourish from there.
And so at First Children's Finance, our big thing is to have each childcare be financially viable, right? And with that, the connecting with employers and communities is the best way to do that. And so we hope that this continues into the future.
When we pitched this idea to our board of directors, we're a nonprofit organization, so we have a board of directors, and we had to get their approval to go forward with this. And they're used to looking at things as lines of service, like you mentioned, and so they were thinking of Pioneer Kids as a line of service. And we had to back up and say, oh, no, wait, no. And so they were asking, well, how are we going to make money, doing childcare? And we said, no, that's not, this isn't a line of service. This is an employee benefit. And it's just one tool in the toolbox. It's not the silver bullet, but it makes a difference. And along with our scholarships and student loan repayment plans and everything else, this is just one other tool. And so that's how we're looking at it. And we're not done with the conversation. We're in conversation with other employers as a possibility. Since we're following a pod model, we could add a pod if we wanted to increase capacity, that kind of thing. So conversation's continuing.
Great. Questions from the audience? All right. You want to tell us who you are?
My name is Sarah Thacker, and I am the Director of Health Training at M-State. I am a nurse. In prior hats, I have been a maternal child nurse and also a preschool teacher. So I wanted to thank you guys because I know what an enormous task that you have been doing. And it takes a lot of courage in coming back to the table when you realize how monumental it is. And then just wanted to encourage all the other people in the room that 80% of brain development for children is done by age 3. That's before they even hit our K-12. So when we want to think way down the road and think of our future workforce, it's starting by giving them quality, stable, loving, nurturing places to grow and for their brains to develop. And just thank you.
Thanks, Sarah. Who else has a question or comment, accolades?
Good morning. I'm Scott McMahon. I'm with the Greater Minnesota Partnership, and we're an advocacy organization that works across all of Greater Minnesota on economic development issues, childcare being a big one of them. So before I get into my question here, I just want to comment that as I see things throughout all of our communities, everyone that has been successful has been because it's been employers, community providers coming together. So for those of you that aren't engaged in these conversations in Ottertail County, please get involved because that's the only way that these things will be successful. For all of you, thank you for what you have done. So my question for all of you that have been working on this, so we try and affect change in St. Paul and provide tools to all of you to be able to make these things more successful. Knowing what you know now, what tool do you wish you had in the toolbox that would have made it better for you? Is it, access to capital? Is it, did you run into licensure regulation issues? If there were tax benefits for the employers, what are the things that we can do down at the state capitol to make it easier for you, not only here in Ottertail County, but in the other 79 counties of Greater Minnesota?
If we hadn't had vacant space, we probably wouldn't, I probably wouldn't be sitting here right now because we frankly couldn't build out a child care center from scratch or a child care provider as we have. And so startup funds, there are more startup funds available than there had been in the past, and we're starting to see that, but it's not like $250,000 to build a small, home-based childcare provider space, that kind of thing. Not that I'm aware of, but if there is, let me know. But also, just the ongoing operation and getting the pay rate up. Lobbying to get the pay rate up for child care providers for those who are working in the profession.
I would have to say I completely agree. We looked at so many different buildings, and more times than not, I think we walked away defeated because it was going to cost so much money to renovate what we walked into, and we thought it was ready to go with a little bit of changes. And so we're lucky and thankful and grateful that the building that came to life, was available. But I think the startup funds, absolutely, and the wages are equally important. But you can have a vision, and it can be very daunting without those funds for anybody. And we experienced that. We looked at, do we build something new? And that was overwhelming. But then it was equally overwhelming to renovate, and we wanted to renovate something that was already in the community. But many times we were always starting over.
Before I answer your question on what I would like to see at the government level, I do want to plug First Children's Finance. I didn't realize the resources they had prior to starting this project, and I think knowing what I know now and after we've had some conversations, I would have chose them over KinderCare to help do our assessments, help us through the financials. So I do, if you are entertaining this idea, which I highly encourage you to do, please reach out to Michelle because that is a really nice resource to have right here in basically our backyard. At the state level, can I just say childcare regulations or the regulations for centers are ridiculous. I was looking at potentially a $30,000 addition to our price tag to renovate the space so the teacher could see all the children at one time. And I know that there's rules and reasons behind everything, but I was like, are you kidding me? There was a child care entity in here. Why can't we just copy paste? And then the ratios that are required and the training conglomeration that is, it's ugly. Like, can we just have one unified thing? So, sorry, I could go on all day, but I was just appalled when I started digging into, okay, what can we do? How many rooms can we open? Well, she's like, I can do this with this teacher, but I can't do this. This one can only cover lunch, but this one can't because they have this training. But this one needs a couple more hours of experience before they can cover breaks and be in the room at the same time as a teacher. So that would be my big ask. And as a parent of this child care center, the reasonings I'm getting, we can't do that because it's licensing. I'm like, what? So flexibility in the child care arena would be great.
That was what I was going to talk about. Licensing, the projects that we're seeing, the centers are struggling, especially in our rural areas. If you're in the metro, you have a licensing agent that'll just come out and look at your facilities. If you're anywhere out of the metro, we're talking months to years. It's taken projects in my area over a year just to get that first licensing visit. And then you have to get the fire marshal, and it's 2 years before a center can open, and that's ridiculous. So I think we should have like a regional licensing person in each of our areas that can come and be that licensing agent instead of coming from the metro.
Lisa Spangler, are you here? No, she's our licensor at Ottertail County. I think she would echo the same sentiments in terms of the amount of paperwork for an individual child care provider and how daunting that can be for new providers and for those who've been doing it for a long time who go, I'm just getting tired of the paperwork. And that might be that one thing that pushes me to be done.
I would like to say, though, in the county now, through Child Care Aware, they have these navigators that come in and hand-in-hand assist with the licensing process with the county, so that has been a plus. It's the centers, because of the state licensing, that has been a huge issue.
Thank you.
I'd just like to add, after we have the facilities and everything, we need the workers. And right now, it'd be great if the governor and government would say, just like they have for CNA, that training is something that we support and should be free. We don't believe that people should incur debt at any level to become a child care worker because it's so essential to our communities. So we've done a lot of work. There are scholarships and other things, but that doesn't remove the barrier for entry. So I would love to see our communities and our state invest in child care workers in the same way we have in healthcare.
Great comments. Other questions? We are right on time. Not that it's a competition, but Nick, I ended right at 11 on the nose. Let's give a round of applause to our panelists.